Assalamu alaikum. My name is Balagamwala, and I welcome you to this new series by LiveDeen, which is going to shift a little bit from our traditional Islamic focused, more academic Islamic focus to something which involves the broader community. We're going to be talking about fitness, about health, about careers, and about different various things that affect the life of a daily Muslim. Today, we're fortunate enough to have with us Dr. Sarfraz Khan. He is the Chief Medical Officer and Medical Director of Psychiatry at Meridian Health Services. Dr. Sarfraz is a well-known psychiatrist in the USA from Indianapolis, and he is a professor of psychiatry at the Indiana University School of Medicine, USA. His initial study was in Rawalpindi Medical College, where he did his MBBS, and then he went on to the Creighton University in the USA, and then a research fellowship at Yale. Dr. Sarfraz has been nominated and named in the top psychiatrists of America for many years running, America's most honored professionals, and he's a regular khatib within the Indianapolis community as well. So, welcome, Dr. Saab.
Thank you.
Dr. Saab, we're going to be talking about mental health and what that means to the people as it relates to the general person. So let's start with a little definition of what mental health is.
Mental health primarily means you're healthy. Right. That's how that's been suggested overall: physical, mental, social well-being. Mm-hmm. This is what our motto at Meridian Health Services, where I worked as Chief Medical Officer. Primarily, any struggle which can make your life harder, whether that is a physical health issue, a mental health issue, social health issue, that does not make you a comfortable and a happy person. Mm-hmm. And whether you look from a secular perspective, you look from Islamic perspective, or you look from anyways, it's very important that by the time you get done with your day, you feel like you have a fulfillment. Your day was good enough for you to say, this is nice, now I'm going to go to bed and I'll start next day with a new zeal and feel what I can achieve. Anything less than that can be detrimental to human health and can lead to some human sufferings.
Right. So, there's this stigma with mental health. If I go see a professional, I'm not crazy, मैं कोई psycho तो नहीं हूँ, things like that. Why do I need to go see a mental health professional, right?
The human life always has stigmas. When you go to surgeon, they used to call them pushers. Mm-hmm. When you go to a doctor, I'm talking about 50 years ago, you're a healthy man, you have been wasting your money. This has been a pattern in any society. Mm-hmm. Every society has to go through the barriers to make the things work. Mm-hmm. Just like when you go to in second grade, third grade, and you do not do well, your teacher may use derogatory terms. School क्या करने आ गए हो? तुम तो कुछ नहीं बन सकते. तुम्हें तो घर जाके बैठ के जानवर चलाने चाहिए, right? तो हर शख्स की ये रिस्पॉन्सिबिलिटी है कि वो सोसाइटी को अपने लेवल पे चेंज करने की कोशिश करे. और अगर ये स्टिग्मा है तो स्टिग्मा तो किसी चीज़ पे भी बनाया जा सकता है. आपका कद, आपकी लुक्स, आपकी ज़ुबान, आप कैसे दिखाई देते हैं, आप किसके साथ कैसे डील करते हैं. सो फॉर सोसाइटी जिसको अपने बेस से ऊपर उठना होता है, उसको सारी स्टिग्मास ब्रेक करने होते हैं. और अनफॉर्चुनेटली इस वक्त मेंटल हेल्थ का स्टिग्मा तो है, लेकिन आई वाज जस्ट लुकिंग एट स्टैटिस्टिक्स कि और हमारे पास कोई ऑफिशियल स्टैटिस्टिक्स नहीं है इस वक्त कि पाकिस्तान इस वक्त कई हज़ार लोग हर साल सुइसाइड मुकम्मल करते हैं, मतलब दे किल देमसेल्व्स. जो लोग अटेम्प्ट करते हैं उसकी तो लेवल बहुत ही ज़्यादा है. इसका मतलब ये है कि ये एक ऐसा इशू है जिसको अगर आप रिजॉल्व नहीं करते तो अगले 20 या 25 साल में ये आपको सोसाइटी को बहुत हद तक तबाह बर्बाद कर सकता है.
And indeed, suicide एक ऐसी चीज़ है जो इस वक्त with the economic conditions and things like that, we're seeing an increased rise, especially even in younger children, right? So that shows us that mental health is something that we do need to focus on and concentrate on it and learn about it so that we can better ourselves in it, right? So before I get into how we take care of the things when you do have a problem, let's just discuss how does someone optimize their mental health in a general way? And what are the things that someone needs to do?
When you go to a restaurant and let's say you try to order something, you try to order soup, it has three major parts. First part is, does the restaurant has all the ingredients which are required to make the soup ready? Second is their cook. And third is the presentation. If you miss any of those, that means you're not going to get the soup the way you want it. Same as mental health. For a human being to be ready, there are at least three ways. The first is a happy childhood. How the parents have been treating and teaching them what the life is. When you look at Erik Erikson, which is one of the very famous professionals who worked on the stages of life, which is very consistent with Islam, that every few years you have to master something. If you and I try to play with dolls, that's not going to work. This is not the age. But children do play with dolls at a certain age. If you try to play cricket and you say, now you're really going to reach at a level and become a world famous cricketer, we can do that. It's beyond that age. So those stages of life have to be fulfilled, to be completed, and successfully mastered at an age. This is the responsibility of the parents. When you miss that one, then the second choice comes, which is you're dealing with the conflict. Every society which is unstable, which makes conflict as a part of your life, is an unsuccessful society. So that's a second issue. When the conflict comes, some people are smart enough. They're smart enough to manage the conflict. Others fall into mental illness. Some will go in drugs. And then comes the last stage. That stage is actually intimacy versus isolation, where you choose to get married and be a happy married couple. Once you are through these three stages, you're likely to do well, and you can be a part of a successful society. Now, where we fail, I do not know, because for every individual, that's going to be different. Some good children who did a very good job, they became good professional, they get married, they could not get along well with their spouse, or the family is way too intrusive. The one thing which I always say, you can have a romantic relationship only with one person. That's your wife. You cannot have the same type of romance with your mother and your sisters and your aunts and your uncles. And if everybody is going to fight for that romantic relationship, that the new person come in and she's really trying to steal what we have, you essentially lead to an unhealthy society, unhealthy relationships, and that creates issues.
All right. So the first thing that starts is the way a child is raised up and how they are told to look at life. So the outlook on life is of primary importance in your mental health, correct?
This is true. The first stage, what we call as trust versus mistrust, that is where the mother is needed. If the mother and the father both are unavailable and the little child has been raised by a nanny, you miss the first point. A certain age comes where child needs to have a lot of hesitancy. Parents come in the picture. They try to tell the child, we are with you, we'll support you. Then you go further and you develop guilt. Guilt is a very important part of human life. What is guilt? That when you make a mistake, you know it is incorrect. All of us, everybody who's present, everybody who's watching, may have been through a time where they tried to steal a chocolate. They tried to steal a pencil. And they took it home, and the mother said, you should not have done it. Go back, apologize, and return. If you don't have that guilt, you're setting somebody to become a criminal. Now, you can be a minor criminal who can, just steal things when the need arises, who can run away from his job, do other things because he lacks guilt. Or he can become a full-blown criminal. Human mind is so complex that we have no way of knowing what person A versus person B will be doing.
Right.
The next age comes where you pay attention to your children, you tell them, take good grades. You make them good students. If you don't have time, you are busy, your spouse is busy, you are partying, or you are in family politics, try to enjoy the relationships which are not going very well in your family. Essentially, you are setting up a stage of failure for your children. This is how life takes and goes on in steps. And if you do not do it, then what you see will be a chaos and more mental health issues, which unfortunately we see lately.
Right. So the conflicts that you mentioned, that arise within us, how do we spot a conflict that is happening inside us?
Human life is very complex. The truth of today is not going to be the truth of tomorrow, or the truth of yesterday is not going to be the truth of today. To give a very simple example, let's say you don't fast. I'm sure you do, but let's say you don't fast. Every day you go out, you take a sandwich and a cup of coffee, and you eat in a restaurant. Now, on the 2nd of Ramadan, you try to do the same thing. You enter the restaurant, you said, I would like to have a sandwich and a coffee. And they would say, we are not serving because this is Ramadan. That's conflict. How you manage the conflict. This is why a society has to be the same. So what is the first thing Islam teaches you? Prayer, namaz. What does Islam say? Before the sunrise, you have to get up and you have to say a prayer. If sunset is there, time is gone. So Islam is taking everybody to the same level. Every man has to look as much alike. Every woman has a certain dress code. Every child expects in a certain way. You learn prayer between 7 to 10, everyone, no exemption. You start fasting in a certain way. So Islam actually takes you away from the conflict.
Right.
The problem happens when you try to do everything according to this is what I think is the best. When you make a mistake, what are you expected to do? If you make a sin, you say 2 rakat, salat, prayers, nafal, that's Allah for forgiveness. So you move on in life. In Western culture, when you make a mistake, you said, I apologize, and you move on. In any culture where you make a mistake and you tend to stick to it by saying, I did it right, you create a confusion. There's a funny saying in one of the other languages that you have to make sure that you destroy the wall of your cousin, even if you fall yourself. They say it in a funny way.
Okay.
So in any culture, when you are unsure what you are trying to get, that leads to conflict. Conflict leads to either failure or resolving the conflict management. A failure in conflict management leads to mental health issues, which can go just anywhere. Then there's no end to it. I hope I answered your question.
It does. All right. So let's suppose that someone is facing some issues in their life where there is that conflict that has started in whatever way or form. Something is happening in their life which they don't want to happen. What is the next step? Because it's one, as we said, there's a stigma around it, right? So then the first thing is, am I crazy, quote unquote, right? Why should I be seeing a mental health professional? Because wo stigma hai. And then the people around us, sometimes they want us to go and we're not realizing, we're not aware of the fact that we need help. Or vice versa, we know we need help, but the people around us don't want to because society will say certain things or something will happen, which is, girls will be told, tumse shaadi kaun karega, who will marry you, or, who will give you a job in terms of, if people know that you're visiting a mental health professional. So how does one get past that and actually convince themselves or the people around them that, help is an important part?
So there are three phases, and that's a very good question you asked. First question is childhood. In childhood, you need to know what you need to know. So when we were sitting and you were trying to arrange this, you wanted to make sure there's a glass of water present. Why? Because you may need it.
Right.
You did not ask somebody that are you going to give me or not? That's what your needs are. So once you are in a growing up phase, parents tell you what your needs are. We know there's a lunchtime. Right. We know there's a breakfast. If somebody tells you, I'm going to give you a good job, but you're going to miss breakfast and lunch, are you going to get the job? No, you would say that's beyond my basic needs.
Right.
That's the first factor. Second is, let's say we failed. Then comes the family. That's what we call as interpersonal therapy. Family comes and supports, and in many situations, you don't have to go to a psychiatrist. You can manage on a family level.
Okay.
But if you're confused, your family is confused, and the society is confused, you ended up being in a struggle which is very, very hard to manage. Then you have a very simple choice. That choice is, if there's a stigma, who cares? And that means you are a strong person inside. There you need the support of your family, of your mother, of your spouse, of your siblings, and not to make a fun of somebody who's needing it. But how you get it, nobody knows. It can be a childhood thinking, which is decent sport, person is strong enough, or it comes in a later life, or it comes from the family. But help is required. Stigma will always be there. No successful man ever became successful, whether going through the hurdles. And then imagine the life of Rasulullah Sallallahu Alaihi Wasallam. They said every bad thing to Rasulullah Sallallahu Alaihi Wasallam, but he knew the message he has to give. So when he was going back, it was mentioned to that now he became a king, and which was not true. It was no, he's not a king. He's a prophet of Allah starting from nowhere to this level. But Rasulullah didn't change. He has the toughest of the life you can imagine. He went to either 27 or 33 Ghazawat, the wars. He buried most of his children except one. He lost his father before his birth. He lost his mother, and if you read the books, it said that he was very young when his mother passed away. And Rasulullah, after burying, was looking towards the grave while he was walking towards his home. And then he had a very tough life. His grandfather raised him, who passed away. Then his uncle, and he passed away. And then he was deeply in love with our mother, al-Mu'mineen, Sayyidah Khadijah, and she passed away. He lost his home. Multiple assassination attempts were made. Yet Rasulullah did not struggle with the mental illness. Because he was very clear what he was doing. I shouldn't say this is the reason, because I do not know. I can only imagine and guess that, we all know Rasulullah had no conflict. He was very clear. So if you follow the Uswa Hasna Rasulullah and we try to live a life which has no conflict, that's where problems start getting resolved. However, religion is not always the answer. Why? Because some of the things have to be done which is right irrespective, which is a part of a society. You can, in a country like Pakistan, you can always say it's religious, but there are other countries too which are happy and successful. Why? Because they had no conflict. And traditionally, when that question is asked, I would quote Mufti Taqi Osmani. He did write it in his book that his father, Mufti Shafi, said that the batil, the untruth, does not have a way to go up. But whenever you see them, rising to the top, you realize they have some qualities of the truth. That's hard work, sport, care, being intelligent, and of course, conflict-free life.
Right. So as you mentioned relationships earlier, relationships are often the biggest source of conflict for people. Right?
True.
And we often see people come in with, my parents are very forceful on me, or my parents don't understand me, right? And then society may you see all this where you're trying to sort of fulfill the rights of the parents, as well as sort of fulfill the rights of the mother-in-law. You often see that conflict happening. So how does one work in an environment where the other person is not ready to change and then takes the sort of the cover of religion saying, these are my rights, you have to respect me, so to say, right?
Can I ask you a question?
Sure.
So, do you know when Rasul asked a question, who he loves the most, what was his answer?
You mentioned his wife, Aisha.
Sayyidah Aisha, not the daughter. Right. Who was, and said, who's after that?
Her father.
Abu Bakr. And what was the relationship with Sayyidina Abu Bakr? His father-in-law.
Yeah.
So in-laws were closer to him than his own family. Right? And then, so on. Everybody he named was related to him somehow. What I said in the very beginning, and I'm going to repeat that point, no society can flourish where you do not let a husband and a wife live a happy life. Yes, there's a lot of blackmailing done by the family. That he married and now we are not as important. You should not be important. Right. Your mother needs to be in romantic relationship with your father, not with you. Right. She should never be fighting with the wife, because Islam's core essence relationship is husband and wife. So if they don't understand, what do? You tell them. Right. You tell them loud and clear. Mom, this is my wife. This is my relationship. This is the reason, and Dr. Israr, I was just listening yesterday, he said it very clearly, there's no concept of joint family in Islam. He said, when you are in trouble, that's a different situation, that you don't have a house, that's different. There's no concept. Your son needs to live with his wife. Let him live his life.
Right.
Every man would like to have a life, Allah has made them that way, according to their needs, and they want to work with their spouse. Married sisters should have a zero role in the family of their brother and the sister-in-law. Right. And let me answer that very clearly. Sayyidina Ali was known as Abu Tarab. Right. All of you heard. You know what Abu Tarab means? The father of the dust. Yes. And do you know how that was given the name?
I don't recall.
I'm not trying to be hard on you, just a way of discussing. Rasulullah sallallahu alaihi wasallam, let's quote it, went to the house of Sayyidah Fatima and asked about Sayyidina Ali. And she said that we have a disagreement. And he left. And he went to the masjid. So Rasulullah went to the masjid. He was laying on the floor and had dust on his back. Rasulullah sallallahu alaihi wasallam said in one of the Qur'ans, Ujlas Abu Tarab. He wanted him to sit up. And he tried to clear the dust. And he took him back to his household. Now you need to understand, it is not only his son-in-law, he raised him. So he has a one relationship that he could have asked that question even from that perspective. And second is his daughter. He did not ask any of them what happened. He made them reconcile and he left. You know what Fuqaha said? They said, you're not allowed to ask what happened between the husband and the wife. That's a very clear boundary. Right. But do we follow that boundary? What I'm trying to say, not only as a psychiatrist, but as a student of religion, when you create a confusing society, that leads to mental illness. And this is where you create the conflict. Mother has a space. She has, of course, tons, but she has no control on the daughter-in-law. She should not have any. There's a lot of discussion which happens. Does daughter-in-law is expected to take care of the son-in-law and mother-in-law? No. There's no concept like that in Islam. But if she does it, that's very nice of her. And that's a very basic thing. When you expect somebody, now you're my new servant, you need to take care of me. It becomes very, very hard for that girl. Rather than when she does and the mother-in-law feels, she's such a good girl, she's taking care of me and said, let me help you. Thank you for taking care of me. So when you try to create conflict, and why do we create conflict? We have very limited knowledge of religion. We have very limited knowledge of civic sense. We have very limited knowledge of relationships. That is the reason the number of our patients with mental health are going up in Pakistan. And it becomes very clear why. When we were in United States, my wife has a very close acquaintance. She was a neighbor, very good girl. So her father's family was visiting. And we were just next door. The family came, and there was a pretty heated argument between the daughter-in-law and the mother-in-law. To an extent, when the mother-in-law chose to step out, she sat in the car and waited. And then the father-in-law followed, and they went to a hotel. Next day, they came back. They stabilized the thing. They stabilized the relationship. And then they went back. That was a big learning. In our culture, at that time, I think that 20, 30, 40 people need to gather and tell the daughter-in-law how bad you are. Right. And you should have gone and apologized. So that's just avoiding conflict. It's a very important thing in mental health.
Yeah, and that paradigm is something that really explains, and it really makes things easy, to see where is the conflict in your life and then, resolve that conflict in order to proceed further, right? And you see that a lot of the people often in our society now, they turn towards gutka and pan and cigarettes and even harder drugs, just because they're unable to face that conflict, right?
True.
And, I often talk to the people I work with, and like, why do you, this helps us get through the day, right? So basically it numbs you down, right? And it numbs you enough that when you get home, anything that is going on at home, that conflict is so they're taking care of it by not resolving the conflict, but the effect the conflict has on their mind, so to say.
Excuse me. It's very important. The time has come. We need to straighten the boundaries. Once you straighten the boundaries, life is going to be easy. First thing you do, learn to say, I'm sorry. I apologize. My mistake. Don't stick to the wrong notions. Clear the dust and the dirt where we are unclear how relationships work. It is very clear for us to know that the relationship of husband and wife, nobody should be coming in between them. This is ethically not allowed. That's socially not allowed. That's religiously even not allowed. But if we choose not to work on the conflict issues, we're never going to improve.
Right. So, John Sahab, let's shift to, when someone does need help, and then they are confused. Do I go to a psychiatrist, a psychotherapist, or this or that, CBT, RBT, DBT, lots of, different types of people who are working in the mental health field. How do you determine where do I need to go?
In an ideal world, this is the job of the family care doctor, which means the general practitioner in your area, who should know this is something which I need to refer. There was a difference between a counselor, a psychologist, and a psychiatrist. A psychiatrist is a medical doctor who has specialties, expertise both in psychotherapy and medications, but most psychiatrists do not have enough time. So what they would do, they generally write medicines. The talk therapy, counseling, can be started from, and we always ask a question, do you know the best psychotherapist in the world? I said, no, well, it's simple. That's your grandmother. Who'd always listen, always support you, always try to resolve the issues. When you keep them out of the family, out of your family, for your children, you lose one major thing. Because the only person who can yell at you and your son at the same time is your father. Right. And he can fix both of you by telling you are not doing right or other way around. When the conflict happens primarily, ideally family should resolve it. Okay. If family does not have enough people who are willing to, or I'm trying to be sarcastic, who are not have enough sense, then it goes to the next level, which is a counselor. A psychologist can do counseling, but traditionally they are set up to do more work than that, which is diagnosing complex illnesses, doing neuropsychological testing. So, those are the extensive 4, 6, 8 hours testings. About a very bright question you asked, what type of therapy? There are multiple types of therapies at this time. And that would be decided by your therapist, which therapy has to go. Cognitive behavioral therapy, supportive therapy, dialectic behavioral therapy, but then it comes to the professionals. But lately research has been telling us, and has been telling us for a very long time, that let's say the commonest modality, the commonest struggle is a major depressive disorder. Major depressive disorder has mild, moderate, severe, and very severe form of psychosis. Both in mild and moderate, medicines may not be required, as long as you have a good support. And I think we as a society need to really rethink for ourselves, because we are sinking as a society, what change we would like to have. If the only thing we like in our life is money, then I think we need to be clear. And we have to come as saying, as a society we have changed. The only important thing left is money. So let's try to make a relationship on the basis of money. Well, that society will fail. So it's, but if you try to go from Islamic perspective, Islam has very clear ideas, how you have relationships. When I was young, I got a book of physiology, and I was reading, and that book said that the best oil for human consumption for cooking is peanut oil, and then comes olive, zaytun. And I read and I said, incorrect. It cannot be right, because Allah subhanahu wa ta'ala talks about zaytun. Almost 40 years later, I bought that book again. And I read the same chapter again. And now that chapter said, zaytun is the best olive, and then comes others. So I would say, don't play with a system which is created by the Almighty who created us. Keep your relationships straight. When you read Quran makes it very clear. Your closest relationship, your little father, very father, and no relationship. If you try to bring your friends, asking them to replace your siblings, you are a clear failure. If you try to flip-flop your cousins with your parents, that would not work. And if you do this, what would happen? You'll end up taking medications for depression, anxiety, panic disorder, and you would be a confused person who cannot manage the life.
Right. So I noticed you said you don't need medicine for everything.
No, you don't.
Unfortunately, we're starting to see a trend, especially here in Pakistan, I don't know about the US, where doctors are very quick to prescribe. And once they're prescribed, nobody wants to unprescribe those medication, right? So we see people who maybe they needed a little support with medication for a few months. And you ask them,
Excuse me.
And you ask them, it's been 10 years since I've been having antidepressants or anti-anxiety or this or that. And most people don't even know what they're having, right? So it's just like, Dr. Saab gave this to me, I'm having it, but what's the time period? How do you determine when to stop medication?
So I went to a restaurant the other day. I was in that restaurant a few years ago, and I got a chance to go again. And I realized their techniques of making food and the presentation was far better. Am I answering your question? Actually, I am. I'm trying to say, when you consider something as very important, you choose to work on getting it improved. When you try to do a casual job, you become a casual person. When going gets easy, you're going down the hill. When the going gets tough, you're going up the hill. Do we spend enough time as doctors? Some of us do, some of us do not. Do we spend enough time in our personal life? Sometimes we do, sometimes we do not. So as a society, you cannot be static. You have to go up or go down. A lot of that responsibility now goes to the doctors. Are they paying enough attention and talking to the patient? At the same time, our patients go to a drugstore and they get the medicines and do it forever. Yes, you save a few rupees on that day, but you have lost tons actually over the next 10 years.
Right.
So the system has to be fixed. Who has to fix the system? You can't take responsibility of everybody, but you can take responsibility of yourself. Start from your home.
Right.
If you have doubts, open Quran. If you have further doubts, open a proper book of Hadith. Read the life of Rasulullah Sallallahu Alaihi Wasallam and realize how he lived his life. And if you can do it, your parents couldn't do it, my parents couldn't do it, not that they didn't, then it's a time for us to start. Having a good and successful society is the key to avoid many mental illnesses. But somebody has to take a decision. And I can only take a decision for myself. You can only take a decision for yourself.
Right. So
anyone can start.
The first step starts with empowering yourself.
Correct.
And being aware of yourself.
Islam is a choice. You have a choice to work with it. It's not pick and choose.
Right.
It's not what type of tomatoes you're going to buy today. Right. It comes as a package. You have to accept it. Right. If you get up in the morning, you choose not to say your Fajr prayer. You miss the first point. When you go to a European country, I live in the United States. When I go to a European country, it takes me a few minutes to find out that this gentleman is American. They have a particular clothing which lets me know in a matter of no time it has to be United States. Okay. When you are wearing shalwar kameez in a certain way, you know very quickly this person has to be from Pakistan. Right. Same thing can be applied. You just have to, are you a practicing Muslim? And Islam has some amazing ways of managing. Do you know the first psychiatrist, they call it in Islam? Sayyidina Warqa bin Nawfal. Rasulullah Sallallahu Alaihi Wasallam went to him with our mother Khadijah. Right. And they talked about what happened. Right. So some fuqaha of the Arab world, they said technically the first psychiatrist was Warqa bin Nawfal because and that clearly says when Rasulullah Sallallahu Alaihi Wasallam was upset and he was worried and he said Zamaluni, that was the time he went to Sayyidah Khadijah, his wife, who gave such an amazing support at that time.
Right. So definitely that support system existed for him, and that is the support system that you're recommending that we create within our households, right? Where someone, when they're having a problem, instead of running away from your wife or your mother or your father, they go to them, Dad, this is what I'm having. My wife, this is what I'm feeling. A lot of times we're trying to mask our emotions. In our society, men Like, I can't tell my wife that I'm weak, right? I can't tell, someone else that I'm weak because they're going to pounce on that, right? So our inability to be vulnerable with the ones who are most closest to us. I remember, in the Quran where Allah subhanahu wa ta'ala mentions that they are like a garment unto you, right? And a garment sees you at your most vulnerable, right? Because it sees you naked in a way, right?
Garment covers you.
Right.
Garment protects you. It beautifies you. It saves you from the harder times.
Right.
So the relationship of husband and wife is such that they cover each other. And please know, a happy husband and a happy wife, they can be an amazing help for the rest of the family. If you try to play with this system and you try to create rift between the husband and the wife, you're not damaging one, you're actually damaging the whole family. Because if there are 3 siblings and one of them has a struggle going on, the whole family ended up concentrating on them. So their ability as a family to give it to others is lost.
Correct. And, that's one of the aspects that LiveDeen, when we decided to work on these aspects, it's good to be able to know the religious injunctions, but sometimes I feel that we're not able to apply that in our daily life because, theory comes on one side in a way. We go to a lecture, we listen to something, and then when we come home, we just, go back to our own systems, right? So what we're trying to do with this series as well, Dr. Saab, is to be able to go deeper into the subject, right? And inshallah, the later conversations we will have, hopefully, will be going into more selected topics, depression, anxiety, even OCD, things like that, where we are able to show the public that, these are problems that you may be having. And as you said, they are coming from some kind of a conflict. To spot them and to be able to deal with them and to proceed forward in your life, right? So the Islamic, the ritualistic aspects, wo apni jagah things will be, inshallah, our people are doing it. But then there's this conflict. Yesterday I was talking to my sister, said, a lot of times what happens is, namaz, dadi, roza, hajj, sab kar liya, and then, you go and cheat at your business. You stop payments for someone. You don't give the proper inheritance to your siblings, things like that. And that conflict is so hard sometimes that someone who looks at religion and says, this guy with a beard doing this, that means, his religion is not working for him, right?
This is
so
true.
They blame the religion instead of the person who is not adopting it, as you said, completely in their life, right? So inshallah, that's a great thing that we have. Do you have any parting advice that you would like to give our viewers on how to empower themselves and set those boundaries? As you mentioned boundaries a few times, how does someone set boundaries without coming across as, forceful or disrespectful to the people around them?
My first advice would be to the parents who have married children. Please don't destroy their lives. It's very important. If you have enjoyed your life or you were unfortunate, you were not as successful, do not try to destroy the life of your son and a daughter-in-law or otherwise. I'm reminding you something which many of you should know. There are some saghira sins, saghira guna, some kabair, the bigger ones. Creating a conflict between a husband and a wife is a serious one. And that does not make a difference whether you are the mother of your married son. It's very important you give them time, you give them respect, you give them enjoy the life what they deserve. And now the next thing I would say to younger people, raising your voice is not an answer. You can always give your opinion by remaining polite, respectful, and maintain the boundaries. I was dealing with a family in a different culture, And the major issues the girl has that the mother-in-law will always come to her room without knocking at the door. That's a serious violation of the privacy of a married couple. If you choose not to keep your children happy, your siblings happy, you are living in an unhealthy and unhappy society. The same son who had just had a fight with his mother or wife will live in a rage. He may end up having an accident and may lead to a point where many lives will be destroyed. Please know, nobody comes from outside to destroy you. We destroy ourselves from inside, and choice is always ours. A miserable life, a happy life.
Well, thank you, Dr. Saab, for your time, for taking this time out from your trip to Pakistan to give us these insights into mental health. And I hope that in the future we can continue these conversations online so our public benefits from your knowledge and your experience.
Pleasure is all mine. Thank you for the invitation.
For our viewers, I want to thank you for the time you have spent with us. Alhamdulillah, LiveDeen goal has always been to create a better individual and a better society. And we hope that what we have learned today from Dr. Saab is something that we take back to our communities, to our homes, to our families, to our relationships, and to ourselves, so that we are able to empower all those things for a better and healthier society. So stay connected to our social media, LiveDeen on Facebook, Instagram, YouTube, and we hope to be continuing these series with different topics. So do tell us what topics you want to talk about, what you want to learn about, and what are the things that affect your daily lives. Jazakallah khair for your time. Assalamu alaikum wa rahmatullahi wa barakatuh.